The Nigerian Medical Association (NMA) has commenced her second National Health Summit. The summit, which coincided with the 25th Commonwealth Medical Association (CMA) triennial conference, drew participants from the medical profession and other health professionals from around the world. The event was also an avenue to invest Dr. Esahon Enebulele as the first Nigerian doctor to become the president of Commonwealth Medical Association. We'll bring you the report.
I will foster the honor and noble traditions of the medical profession.
With the theme, Patient-Centered Care, PCC, the summit brought together medical doctors, health professionals, captains of industries, and government functionaries from across the world. Declaring the summit open, President Muhammadu Buhari, who was represented by the Minister of Health, Dr. Osage Enahire, stated that patients must have access to information about their illness and be respected.
As you commence activities to mark the second National Health Summit of the Nigerian Medical Association and the 25th Triennial Conference of the Commonwealth Medical Association, I welcome all delegates from all parts of Nigeria to this conference, and also particularly welcome the delegates from the Commonwealth and the President and other executive members who are here to participate in the activities of today. There is no greater measure of the quality of healthcare anywhere than the priority accorded to the patient at every level of treatment at all times. It is no longer just enough for the patient to be assured of accurate diagnosis and treatment of his ailment. He expects and must be accorded full confidentiality and due respect so that patient experience begins to improve in our country. The care of the patient also envisages that a patient must have access to information and education regarding his illness to enable him participate in making informed decisions.
The chairman of the event and former president of Nigeria, Dr. Yakubu Gowon, in his remarks outlined the gains of the first summit. He also called on Nigerian Medical Association to take advantage of the National Health Act to improve the health sector.
I'm very delighted to be here with you all, surrounded by medical practitioners of different callings and other professionals in the healthcare sector. Part of the gains of that edition is the promulgation into law of the National Health Act, which set aside 1% of the nation's consolidated fund as the basic health care development fund. It is my hope that the fund shall be utilized appropriately for the purposes of healthcare development in the country. I am convinced that this second edition of the Nigerian Medical Association's National Health Summit would bring out ideas and suggestions that would be accepted on board by the government for further improvement in the healthcare sector.
The keynote speaker, Dr. Ifeanyi Okowa, in his address stated that the patient-centered care model focuses on patient satisfaction and that patients must participate in decision process in the overall health system.
I wish to express my appreciation to the President and executive members of the Nigerian Medical Association for the honor to address this elite gathering. I'm thankful and humbled by this special courtesy extended to me. I need to also commend the Nigerian Medical Association for its drive and passion to improve medical practice in the country for better patient care and health outcomes, as well as canvassing for standard operative environment for its members and other healthcare providers in line with global best practices. The theme of this summit addresses a very vital aspect of healthcare management that is critical to delivering quality healthcare in Nigeria and ensuring the best possible outcomes and experiences for patients, carers, and families. Patient-centered care is a practice of caring for patients and their families in ways that are engaging, meaningful, and valuable to the individual patient. According to the Institute of Medicine, patient-centered care is providing care that is respectful of and responsive to individual patient preferences, needs, and values, ensuring that patient values guide all clinical decisions.
The National President of the Nigerian Medical Association, NMA, Dr. Francis Faduyile, in his remarks, stated that the theme for the second National Health Summit is apt because it puts the patient first.
The second National Health Summit has its theme, patient-centered care. The NMA believes that patients' preferences must be respected. We also believe that the care of patients must be coordinated and integrated in a manner as to achieve the best possible outcomes. We believe that our patients are worth it, and so our patients must be seen in a friendly and conducive environment that is deserving of their worth.
The summit provided an opportunity for a Nigerian doctor, Dr. Esahon Enabulele, to be invested as the first Nigerian to become the Commonwealth Medical Association president.
Ladies and gentlemen, this is the moment. This is the moment. A round of applause. Congratulations, Nigeria.
There were goodwill messages from the governor of Nasarawa State, Engineer Abdullahi Sule, and other health professionals.
It is indeed a rare privilege for me to be invited to this special two-in-one event. First being the second National Health Summit, as well as the Commonwealth Conference. Let me join actually in congratulating both the outgoing and the incoming leadership of the NMA, as well as Dr. Enabulele as the president of the Commonwealth Medical Association. This is not a small achievement for us as Nigeria, and want to say thank you very much for that achievement.
High point of the event was award presentation to friends of the Nigerian Medical Association and other individuals who have contributed to the growth and development of the Nigerian health sector. In Abuja, Tony Abba, CTV News.